moving from a sedentary to a physically active societal way of life. This is Up on Our Feet.
Welcome to Up on Our Feet. It's now well known that physical activity not only enhances individuals' physical health, it also enhances cognition, how a person's brain works, and it enhances their emotions, how they feel. Of course, this is all well and good for individuals. Just about everyone wants to be healthy, mentally sharp, and feel good about themselves. But there is also an added benefit to all this that goes beyond individuals that has to do with the impact of physical activity on a macro cultural level to an entire society. And this is the theme of a study that was published earlier this year on the relationship of public health, economics, and climate change mitigation to cycling as an active form of transportation in France. The study showed an interconnection between these three cultural domains and what they have to do with cycling. One of the authors of this study is Professor Kévin Jean, an epidemiologist in health and global changes in the Department of Biology at École Normale Supérieure, a leading research institute in Paris. His research combines approaches from epidemiology and mathematical modeling for the evaluation of prevention strategies, especially to document the health co-benefits of climate change adaptation and mitigation policies. His work has also focused on the prevention of infectious diseases and occupational diseases. Professor Jean, it's nice to have you with us.
Thank you so much for the invitation.
Sure. Okay, let's start off. First question. In your study, it mentions that France currently has a low to moderate cycling culture. This being the case, what led you to do a study that looks at cycling's impact on public health, related economics, and climate change mitigation in France?
So as many countries, we have had many debates, social debates about the role of cycling as a transportation mean in France during the COVID crisis, because many bike lines have been created during the COVID crisis in cities like Paris, because it was one of the safest way to travel. And then because, as many countries, France has signed important engagement pledges for climate change, to fight climate change, and to follow a target of net zero emission. And in France, as in other countries, transportation is the main sector of greenhouse gas emission. So we had this hot debate about the way cycling should be developed in order to reach climate objectives. So in parallel, we have this very well established knowledge that cycling could be a public health instrument to improve the health at the level of a population. And it looked like a good opportunity and a good momentum to link both topics, climate and health benefits of cycling.
Okay, so tell you what, before we look at the specific topical results of cycling's impact in France, what were the general results of your study, the summary conclusion?
The summary conclusion of the study is that actually cycling is a public health intervention. So if you want to improve the health of a population at the level of a country, developing a cycling infrastructure would work as much as the tools that we have in public health, like medical tools, diagnosis tools, and that's a very good and very efficient way to prevent health, and also for the community to save money.
Okay, well, tell you what, then in this context, let's break out these results, okay? First, what did your research show was the impact of cycling on public health?
The way we see that is that when we discuss about cycling and the role that cycling should have in the population transportation policies in France, we talk about energy, we talk about infrastructure, but we never talk about health and public health. And so that was the way we wanted to like impulse the fact to also include and consider health aspects when discussing transportation policies, and especially active transportation policies such as cycling infrastructure and promotion.
Okay, and so can you name some of the specific health benefits that came out of the study? You know, how was people's health? How was it impacted? You know, was it in cardiovascular health, or
Yeah.
exactly how?
So our own study that we conducted relies on previous epidemiologic studies that did highlight and measure this association and this link between cycling at the individual level and health. And what the scientific available evidence shows is that cycling is a predictor of reduced mortality. People who cycle die less. If you look at all-cause mortality, and this is based on meta-analysis of cohort studies. So it's something like the highest level of evidence we can have in epidemiology. So that's the main topic. I mean, if you look and if you try to look at how many people die, like mortality rates, and you contrast that with regards to the cycling levels, considering all things, all other things equal, you'll see lower rates about and for people who report cycling, and the difference is high. I mean, the relationship that has been previously established by the literature is that people cycling 100 minutes a week die in average 10 have a reduced risk of mortality reduced by 10%. 10% mortality risk reduced for 100 minutes cycling, 1 hour and 40 minutes. That's massive. So this is for the most important health outcome that we are looking for, like mortality. But we know that cycling also reduced a number of chronic diseases, and this is also based on meta-analysis of observational studies, epidemiological studies, cardiovascular diseases, type 2 diabetes, also some mental health diseases like Parkinson, Alzheimer disease, sorry, and also some cancers like colon cancers and breast cancers. That could be other conditions or diseases that cycling could reduce, because we know that physical activity has an impact of virtually all physiological aspects of human being. But I mean, these chronic diseases are like a subset of disease for which we have consistent and robust evidence.
Mhm. Okay, so what you're really saying is the potential for cycling as an active mode of transportation in France or any other culture has a comprehensive effect on health. It's related to just about all aspects of people's health. Is that what you're saying?
Yeah, I mean, this is related to what WHO, the World Health Organization, says in relation with physical activity generally. Physical activity is one of the main predictor of good health. At the scale of Europe, for example, a continent like Europe, it's been estimated that the lack of physical activity could be responsible of 10% of death. We could prevent 10% of all deaths by reaching the recommended levels of physical activity, because we know that physical activity reduces, improves circulation overall, reduces the risk of cancer. We also know that even at the cell level, it affects some biological mechanism that sorry, I'm not remembering the word in English.
Okay,
Sorry about
that's
that.
all right.
But I mean, we have elements to make that clear at each level. I mean, physiological, the level of the organ, physiological level, cell level, population level. We have very very broad, comprehensive view about that.
Okay.
And I
Well,
mean, cycling is a way to improve physical activity. That's not a magical tool. I mean, when you're cycling, you are actually you're producing your own motor. So you're producing this physical activity, which an electric or thermic car doesn't do.
right. Okay. Okay. So with all these health benefits then regarding cycling as an active mode of transportation, what's the economic impact or what are the economic benefits that are related to the improvement in health from the cycling?
Okay, so cycling prevents some death and some chronic diseases. So that's what we show in the study. And based on that, economists may have develop tools to estimate the costs that any intervention, public health intervention could prevent. So economists do distinguish two types of costs. First, there are the direct costs of disease. So we know that, for example, in France, an average case of type 2 diabetes uh, induces medical direct costs of about 400,000 euros.
Mhm.
That's the way. I mean, this is like the costs of your medication, the costs of your visits to the clinic. That's also the health coverage that you perceive in France when you can't be working for that. And this, we have the database to uh, estimate the direct cost that each kind of disease, either uh, cardiovascular disease, type 2 diabetes, cancer, do costs. And by knowing estimate the roof number of days, condition, and diseases that have been prevented by cycling, we can estimate days direct costs. And this is cost that is not spent by the health coverage in France. So that's why we call these direct medical costs. But in another way, these cuts do not cover all the negative aspects of the disease. A disease or death has also some negative aspects. I mean, the psychological distress for yourself or for for your next of kins, and these are things that can't be quantified in terms of direct costs. So economists do develop some methods to value health in terms of money, and that's been called the indirect cost of disease or social cost of disease. To give you a rough estimate, based on these methods, we estimate in France that preventing one death could be valued to 2 million euros, something like that, to have an order of magnitude. But that's interesting because it covers other aspects and non-merchant aspects of costs, but on the other way, that's not palpable money, if I may so. If I'm That's not tangible. These are called intangible costs. You know that it doesn't really represent some money that the state, the government, or the health coverage would not spend. This is another view of these costs.
Right.
So
Okay. So there, it's not just one aspect. There are a number of aspects, or like you're saying, direct and indirect costs that are related to the economics of cycling and how it impacts people's health. It's pretty comprehensive.
yeah, so these direct costs are kind of um, precise estimates of how the health coverage in France could save, how many money the health coverage could save by if as a country we manage to develop cycling. But we know that this doesn't cover all the benefits, or this doesn't measure all the benefits of cycling. Another example is that when you die, you don't imply any medical costs. So I mean, these direct costs are totally blind to death prevented. So that's why other metrics have been developed, such as intangible or indirect costs. Uh, and I mean, there are like two aspects, or two imperfect measures, say, to estimate the value, the health value of cycling or any other health intervention.
Mhm. Okay. Okay, so we've talked about the public health benefits. We've talked about the economics of this. How does cycling relate to climate change mitigation?
Okay. In the study we conduct, we have been interested in estimated uh, by how much shifting some short trips that are now done by individual car, shifting these short trips, so less than 5 kilometers, something you could realistically transfer to cycling. We were looking by how much this would save in terms of CO2 emissions. And to do so, we simulated a policy, a public policy that would manage to shift 55, 25%, one over each, 1/4 travel of these short travels from car to bike. So we were actually looking at existing patterns of travel and to look at how much we could gain by shifting some travel that are now made by car to cycling. That's the way we did. And we know the average CO2 emission by an average car in France. So that's the way we are able to assess how many greenhouse gas emission we could save.
Okay. So then regarding the climate change mitigation, were you able to come up with the economic benefits related to this, the way you were with the public health?
Okay, we could have done so. We did not, but we could because there has economists do also have developed some value and put are able to put a value to each ton of CO2 that is not emitted. So we did not go up to that, but we could have done so. And actually, I don't know whether we did not do so. But no, things we know is that these estimates are much lower than those gained by health for two reasons. First, because the health benefits are massive, and second, because based on the tools that we have now, we know that the value of each ton of CO2 is largely underestimated by the economic method we have at the moment, because they don't represent all the negative aspects of climate change. So that's two reasons why we did not go up to that. But the gut feeling we had with the colleagues and the co-authors of the studies that and the feedback we had is that health benefits have really an order of magnitude superior to then the valued climate benefits of cycling. But I
Okay.
mean, nevertheless, this is a same tool to fight two crises, and we have this very nice convergence between climate goal on one side, public health goal on the other, that could be addressed by the same tool.
Mhm. Okay. So earlier, we mentioned that France is a low to moderate cycling culture. You had that in the study. Given the results that came out of your study, what would be the public health, economic, and climate change mitigation benefits if France became a solid moderate cycling culture or even an advanced cycling culture similar to the Netherlands?
Okay, what we measured is that for a country like France, if French people would cycle as much as people in Denmark or Netherlands, we could gain something like 6 months in health expectancy, which is massive. I mean, 3 to 6 months of health expectancy is what we've lost during at the worst period of the COVID-19 crisis. So in terms of, once again, in terms of public health intervention, this is a massive gain. And then in terms, if we just looking as we did in terms of direct CO2 emission avoided, this won't be a massive difference for a country like France. Why? Because the trips that you could convert from car to cycling are short trips that do not represent the large part of all kilometers traveled by car. I mean, we know that long distance travel by car are like the big elephant in the room, and these could not be replaced by cycling. However, we know that when you shift from one culture, and France is still on this car culture, to another, like a more very much bike-oriented culture, you could have transfer or indirect effect that would lead to more important societal shifts. But this is something you can't quantify directly as you can for direct CO2 emission prevented.
Okay. So then, given these benefits that you just mentioned, wouldn't policymakers and government officials globally be wise to advocate and create programs and infrastructure that would get more people to use cycling as an active mode of transportation?
Actually, at the level of a metropole, a city, cycling is the best tool for transportation, as much as public transportation, because it has a much lower occupation of space first. So in terms of congestions, it's much more resilient than car. It has climate benefits as well, and it has public health benefits. So there is no, there is no, for society, no bad aspects about cycling. You have very convergent goals. And this is not just my opinion, this is also what the World Health Organization mentioned. The main aspects about that, and this is the relationship we identify or we estimate in the study, and that's to me would be a good way, a nice way to convince policymakers. We estimated that in France, for each kilometer cycled, the society prevents €1 of indirect or of social costs, social earth costs. So €1 saved per each kilometer cycled. So this is a very nice way to show that promoting cycling is not something that just generate costs, the cost of infrastructure, the cost of promotion, but also that's something that can generate gains, and that the magnitude of these gains is very important and much larger than what was estimated before.
Okay, so then what you're saying is, it would be very smart, very wise for the policymakers and government officials to promote cycling as an active mode of transportation. In France and other countries in the EU, to what extent are the policymakers and government officials promoting cycling as an active mode of transportation, especially with all this research?
Okay, I should add before answering directly to that on the other aspects that cycling provides benefits, the obvious aspects are air pollution. So you do not emit air pollutants by cycling. Injury risk, there is much less death by cycling than by car, or in case of collision with pedestrians. So benefits in terms of land occupation or space occupation, and that gives you room to add some green spaces in your cities that are a good way to be resilient for climate change and to decrease temperature during the summer. So there are very numerous aspects, beneficial aspects of cycling. And so your second question, so how policymakers in Europe or France promoting cycling? That's the question. So it depends. And in some cities, we are now at the moment witnessing large changes. Where I'm living in Paris, there has been massive changes since the COVID crisis. So in very few years, in 3 or 4 years, the number of cycling has been multiplied by 4, something like that, because a large number of infrastructure has been finished and have been made available by the local authorities at the very good moment, because that was the COVID crisis, as I mentioned. And in some places like France, like Paris, for example, we have witnesses these changes, and these are massive shifts at the level of a metropole. That doesn't mean that this is the case everywhere. And for example, we have obviously it's much more difficult to promote cycling in rural areas, but when policymakers make that a priority, you can observe this kind of rapid shifts in the practical cycling levels, and then in the practices of the population.
Okay, so this is what's happening in Paris. This is what's happening in France. What do you think needs to happen for cycling as an active mode of transportation to increase everywhere? What has to happen? Do you know? Any idea?
So first, this is about changing mentalities about people, but also about policymakers. Then this kind of policies is something that is not very well appreciated by the cars producers, for sure, because this means that, I mean, the urban space, the economy in France, like in many countries, has been developed around the car model in large places around the world, and this is something that needs to change in the face of the climate change crisis. And this is also one of the main break, say, to the development of a cycling culture.
Okay. All right. Final question. Over the course of your professional career, and with all the studies and projects you've done regarding the impact of physical activity on health, economics, and climate change mitigation, in the big picture of things, what's the big message, the big takeaway, the major conclusion you've come to?
Okay.
It's a
Nice
big
question. So,
question.
yeah. So during the project I conducted in the last few years, I mean, the main message I want to share, and that's the evidence, the available evidence shows, is that policies that are good for the climate are also policies that are good for public health in the short term and at a very local level. And that's a very good message to promote climate action. I mean, by promoting climate action, you promote a better climate on the long term, but overall or parallelly, you promote better public health now and here.
Okay. All right. Professor Kévin Jean of École Normale Supérieure Research Institute in Paris, thanks for being with us on Up on Our Feet.
Thank you so much. And thanks again for the invitation. My pleasure.